If I hit you on the finger with this, would it hurt? Probably would, right? And would you say my finger hurts, or would you say something else? What if I said to you that pain does not exist in your finger? And how is it that if you get a cut with one of these, it can sometimes be as painful as a cut with one of these? Here's the thing about pain. You'll hear a lot of different people, chiropractors included, who will talk about treating your pain. And what I wanted to describe to you is why that's not accurate. Pain is actually quite complicated. It's not something that has a location except for how you interpret it in your brain. So let's say I did happen to whack my thumb or finger with a hammer. What we have is a whole bunch of different nerve endings which respond to different changes. We have some that respond to stretch, some that respond to being squashed, others that change activity with the heat and temperature, others that change activity through chemical variation, for example, through inflammation. So all of this information gets sent up to your brain, and your brain then has to interpret what that all means, but it doesn't just use that information. What it uses is a number of other features. It firstly asks your history and your brain, have I had this type of information sent to my brain before? And if so, we'll compare those two things to make a decision about how to inform you about what's going on. So your brain is doing this in the background. It will also consider, well, what is the current social environment that I'm in? Is it appropriate to experience pain in this example? I'm guessing that, for example, in some indigenous tribes, there are certain activities where it's not appropriate to show that something is painful. And there's also the question, what is your current state of mind? Are you at ease? Are you relaxed? Or are you stressed? And all of these things combined are used by your brain and is going to give you a conscious awareness of what is happening at the site of pain, as it were. However, it's an interpretation. It's not a thing. You might notice I didn't say at all that there is a nerve ending that tells you specifically my finger hurts. Those type of nerve endings don't exist. It's a culmination of all these input that your brain tells you what's going on. So it's an interpretation. It's not quite an emotion, but it's very close to one. And so anyone who says, I can treat your pain, can you see how it's not really accurate? What they're doing through whatever type of treatment it is that they do, and there are many treatments that help, because what we're looking to do is say, well, if the cause is, I don't know, heat, then if we cool it, it might change it. If the cause is tight muscles, if we relax the muscles, that might help it. If the cause is a joint that's jammed up, like in chiropractic, then that might help it. But all we're looking to do here is change the input from a few of these different things and cross our fingers in many regards that the brain will react. And that's why not all treatments done at the same point, at the same time, for the same problem are going to cause pain relief. It's also why when doctors will, for example, inject you with a cortisone or a pain reliever into the supposed painful spot with no effect. It's because the pain is actually here. Now, my reason for talking about this is that there are many different ads that you'll see pop up everywhere. There'll be new pieces of equipment that are being sold online or on your Facebook feed or whatever social networking you're involved in. And many of them will talk about pain relief and getting your pain under control. And all they're looking to do is try and give you some kind of symptomatic relief, but not get to the cause. Now, if we talk about the cause of back pain, which is a big input or a big problem for many people in terms of their quality of life, in more than 90% of the case, the cause comes from the spine not functioning well. And when the spine doesn't function well, you can appreciate that the brain is going to be going, what on earth is going on? It's like somebody is constantly whacking on your finger. It's going to distract you from getting on with life. So chiropractic is all about not just restoring function, but doing so, freeing up your brain to do what it needs to do best, and that's control everything inside your body, respond much better to your environment to keep you healthy and happy. And with that, of course, it's going to make a difference in terms of your quality of life and, of course, what you can get out of life. I hope you found that interesting. There is more information on my website. There is a written form of this information. If you go to chiroLoungeLindale.de, go to the English site, and under Chiro News, you'll see a whole bunch of different topics there, and one that is talking about pain specifically. Have a great day. Feel free to pass this message on, this video, and if you have any questions, please fire them to me as soon as you want. All right, have a great day. Bye-bye.